Good morning, Warrior Nation. My name is Scott Gaughan. I'm the superintendent here at Westside. I'm joined by Ms. Holly Crow, middle school nurse and our COVID point of contact. As we're socially distanced right now, we're going to go and remove our masks so you can better hear what we're going to have to say to you today. We're going to be talking about COVID and how we get our numbers and how we disseminate them to you. What we're going to do is we're going to send you to a website that shows you the information that we have and what we use, and hopefully you can use that to better understand where we're coming from when we post our numbers as far as who is positive and who is not. So at this time, what we do is we utilize a website, ACHI, which is funded and utilized through the Arkansas Department of Health to give case loads for every school district in the state. And what they do, as we roll up, what they do is they show you a school and a map, and you can choose by community, by school district, by zip code, or even you can find out about the data. But what we do is, when we tap by the school district, what this will show you is per county how many positive cases are in that county. Now, we've had a lot of misinformation out in the last few days about things that have been reported in the media. Some of the things are saying Westside is in the hot spot or in the red zone. And that is true, but it's not the school district. It is the county and the community that we serve. So when we isolate on the Westside district, and what that shows you is the boundaries of our district. So that includes parts of Jonesboro, Bono, Cache, and Egypt. That shows you how many cases are currently in our area. And that's not just students. That's not just students and teachers. That is all the adults and all the people in our school boundaries. So as you can see, right now, and when I say right now, that means as of 10:45 on Friday morning, because these numbers change very quickly. But as of 10:45, you can see that we have 50 or more cases per 10,000 people. That's a positive rate of 0.5% of our people, of our population. So, but moving forward, you can see in our county or in our area how many people are positive. But when you look further down, they will have broken down per district how many positive cases we have. And if you read here, it says values are only included for districts with 5 or more active cases. The numbers below reflect cases in the school district itself. So these numbers are what we have in our district right now, according to the Department of Health. And you can see cumulative cases, we don't have 5 yet. And we don't have any of these numbers filled in because we haven't hit their thresholds yet. Our staff, our nursing staff, our custodial staff, our administrators, our teachers, even our students are working very hard to keep these numbers down. And we realize that as we continue down this path with COVID, we're going to get cases. We're going to have these issues arise. So, but this is where this information is coming from with the Jonesboro Sun, the KIT. You can check any school district in the state. You can move it over. You can check Jonesboro or any of our surrounding schools. You move right up. There we have Lawrence County, which is Walnut Ridge. Jackson County, which is Tuckerman. Move over that way. This way. Right. That's Greene County Tech. And so you can see how this works. It'll show you exactly how many cases per 10,000, how many cases the schools have. Go right over here, ma'am. Down to the red. There you go. So this is a neighboring school, and you can see their caseload in the school district. So you can see a comparison as to where they're at versus where we're at. If you move back to ours. But that's how we're getting our information. So when you see that Westside is in a hot zone, what they're referring to is our school boundaries, okay? Not the school district itself. And you can go check this. This is updated multiple times a day, so you can go find this anytime you want to. And the address is right here. It's achi.net/COVID-19/. And all you have to do is you can pick, like we showed you, the community or by school district. Now, moving forward, as we see more cases come up, what I'm going to do is I'm going to turn it over to Ms. Holly and let her give you the protocols that you will need to follow so that we can help keep these numbers where they're at. Ms. Holly?
So what we ask, if someone in your house is sick, we ask that you keep that student home. That way, if they have symptoms, we ask they're symptom-free for 48 hours. If someone in your home or your student gets tested, we ask that you go ahead and remain off campus until we get those test results back. Just pick up the phone and call me, or you can email me and we'll give you that information again. That way we can track it and make sure that we're keeping everyone safe on campus. Now, if your student tests positive or someone in your home tests positive, then we ask that you give us a call so we can trace and see who that student was around. And it's 48 hours prior to onset of symptoms or 48 hours prior to a positive test. So if there are someone on campus who could be a probable close contact, we want to go ahead and quarantine them as well so that they can get off campus and not possibly spread it to others.
And now piggyback off what Ms. Holly had to say, what we want to impress upon you is the fact that we do have positive cases on campus. We do have students and staff who are quarantined. Please understand that we will not be able to give you personal information. By law, Ms. Holly cannot tell you who is sick. Those people have rights as well. But what you need to understand is, as a patron, as a parent, when Ms. Holly goes and starts doing her contact tracing, she will contact you if your student has been put at risk. I've got students on campus. My students have been in this scenario as well. I know without a doubt that if Ms. Holly calls me, my students have been in contact with somebody who's positive. If she doesn't, then my students haven't been there. She is doing a great job of utilizing all the guidelines by the CDC and the Department of Health as far as distancing, masks, all those things to determine who is a probable close contact. So as we work forward through this, understand that one of the ways we're transitioning from on-site to virtual is simply Ms. Holly would find a student who may be a probable close contact. She would have that student go home. Okay, now in a typical world, that would be a problem as far as our instruction goes, but with our instructional techniques set up as they are, our students can transition from on-site to virtual without missing a step. And what that means is your student can be in class with a teacher and, for math or English or whatever that might be, and transition to home. And the next day we'll be in the same classroom, just doing it virtually. That teacher will be able to speak to them. The student can speak to the teacher and ask questions. They will receive the same instruction, the same instructional pace and materials as the students in class. So that's been a very big tool for us as we move students in and out of our campus. If we have somebody who may be positive or may be a probable close contact, we can just send those students home and feel comfortable knowing that they're not going to miss any instructional time. So that's been very positive for us. It's been a great way for us to keep our numbers down. Ms. Holly has done a great job, and all of our nurses are working as a team. They've done a great job making sure we're tracking these students. We know who's coming into contact, and we move those kids forward. So as you look forward to how we're going to move through this pandemic, just know that Ms. Holly, the nursing staff, the administrators, the teachers are all working very hard to make sure that we keep your kids safe, to keep our staff safe, and at the same time give your kids the education and the experience that we all want for them in our school setting. So once again, if you have any questions, please contact Ms. Crowe. Her email address is hcrowe, and that's spelled C-R-O-W-E, at westsideschools.org. Of course, my email is sgaunt, and that's G-A-U-N-T-T, at westsideschools.org. We're happy to answer any questions you may have. We can work through this together. If you have questions again, we can answer those in a general terms. We can't tell you exactly who is sick or who has been sent home. But one other thing on that point is please remember that this is the cold, flu, strep season. So many of our kids that we send home are sick with the cold or the flu or may have strep. So if you hear of a student being sent home or a teacher being sent home or not there, please don't automatically assume that this is COVID. We have had, if you go back to last year, we had a number of students who were sick. Your child has probably been sick and you understand how that works. So there's a lot of different reasons why a teacher may not be in class or a student may not be in class. So please don't jump to assumptions. Please let's work on this together. And as I put in some Facebook posts before, together we can keep this where it's at. Our numbers are great right now. We do. And we're not sticking our head in the sand. We understand these numbers may and probably will rise, but we're going to do everything we can to keep them as low as we can so that we can take care of our staff and our students. So moving forward, thank you very much. We appreciate your time, and go Warrior Nation.